Shrinks are what they are more commonly called, but to me, psychiatrists are one of the most needed professions, and they have one of the most rewarding jobs that any person can have. But for me to aspire to become a psychiatrist, I had to take a look at what was needed to actually get into psychiatry. So to explain it to you, we're going to explore the field of psychiatry. So we're going to look at the schooling or education required to become a psychiatrist, the job description and work environment of a psychiatrist, and finally the need for psychiatrists in our nation, and finally the pay that psychiatrists receive for their services. So to begin, we're going to first take a look at the education required to become a psychiatrist. According to a study.com article titled Undergraduate Majors for Aspiring Psychiatrists, they give an outline of what prerequisites that you need and the undergraduate majors that you would want to take to become a psychiatrist. So the prerequisites that they outlined was obviously a high school diploma and a qualifying SAT or ACT score. They were not specific on the certain score that you would need for a pre-med program, since it varies from school to school. And undergraduates, you can take any undergraduate that you want to get into medical school, but the three main ones that they said would be the best is psychology, chemistry, and biology. Psychology is the study of how the human brain works properly. So this is how a normal person that doesn't have any mental disorders would work, so that you can use it to compare when you get into the psychiatric field. Chemistry and biology is what's going to help you get ready for the MCAT and get ready for studying anatomy and physiology and diseases in medical school. So once you get out of the pre-med program and you continue on into medical school, you're going to have to go through 4 years of psychiatric schooling. So according to a Georgetown Medical School article written by Stephen Allen Epstein, MD, he outlines each year in great detail, but I will give you a quick synopsis of everything that he said. So during the first year is you're learning communication skills. So you're learning how to interview, how to even give speeches, how to explain a diagnosis or to break bad news about a diagnosis to patients or to family or even to the care team. During your second year is where you learn the phenomenology of mental disorders. So you're learning how they affect the conscious brain of a person. So this is what you can see. So like me talking right here, this is what you can see and this is what's in my consciousness. So that's what you would see with someone, whether it's them talking to themselves or someone acting schizophrenic, which would be more paranoid. And then during the third year is where you take on a bigger role in your psychiatric training. So this is where you work with psychiatric teams in hospitals and health clinics to be able to start to understand what you're getting into through medical school and going into the psychiatric field. So about 3/4 of the time, Stephen says, you would spend in a hospital, since that's where most psychiatrists would spend their time with different forms of patients. And then 1/4 of the time you would spend in a clinic. So this would be like a private practice that someone would have, so it'd be like a therapist or even a home for people that have mental disorders. So during your last year, which is your 4th year of psychiatric training, you are basically going into a specialization. So there's 3 main specializations. So that's child, general, and geriatric. Child is adolescence, so that's anybody younger than a teenager all the way to a baby even, which there's no need for that. General is anybody on the age spectrum, so from a young child all the way to an elderly adult. And then finally, geriatric is elderly, so this is where you would focus on elderly people and their psychiatric welfare. So now that we've taken a look at the education required to become a psychiatrist, we're going to continue on to the job description and the work environment that psychiatrists have in their daily services. According to a myplan.com article, or description, of psychiatry, or psychiatrist in general, basically psychiatrists are like doctors, and they are doctors because they've gone to medical school. So they diagnose mental disorders through tests and findings that they find through that test. and then they diagnose it, like I said before, and then they prescribe medicine to that person, or they direct treatments through the care team or through the family. So they also create a care plan for that specific patient. They also explain it to the care team and to the family. With all doctors or medical establishments, you have to, and this is a must, you have to create files and cases for each person, so that when the time that you have to submit them to the government and mental health agencies, you will be able to continue practicing, since they evaluate what you are doing. And finally, you will serve on committees that would promote general mental health welfare. And the quick synopsis of the work environment: you are working in a very tough environment because you have to look at the mental part of how someone's acting. You also have to think very critically when you do it, because you have to eliminate different aspects that could be affecting them. You also have to be a teacher. You have to be able to teach other younger psychiatrists, or your psychiatric nurses, or even the family if they're wanting to take care of their family member. So now that we've looked at these two last pieces of information, we're going to finally conclude today with the need for psychiatrists and the pay that they receive for their services. So finally, according to usnews.com, in an article, "Where Have All the Psychiatrists Gone?" it gives a few statistics that help push the need for psychiatrists. So it showed, from a time span from 1995 to 2014, the amount of physicians grew by more than 45%, whereas psychiatrists, they only grew by 12%. Included in the article is also talking about the population growth. So the population grew by more than 37%. The need for physicians outweighed what the population needed. So physicians were fine, but psychiatrists fell short, which then created a huge deficit for people that were left with mental disorders such as depression or schizophrenia or any other mental disorder. So the need for psychiatrists is obviously very dire, but the pay is even more rewarding for psychiatrists. They work from anywhere from 48 hours a week, about most of their time spent with their patients, and they earn about $160,000 to $300,000. Today we have explored the field of psychiatry, the study, the education, the job description and work environment, and the need and pay for them. So hopefully one day you'll see a billboard with my face on it in my own practice.